The country is coming down from another wave of COVID-19 in different parts of the U.S. Nationwide, new cases are down 57% since the peak around September 1st, and hospitalizations have dropped by more than 50%. Here in Colorado, though, a very different story with COVID-19 numbers on the rise. Within the last hour, Governor Polis shared the steps that he and doctors believe we all need to take to stop the spread of COVID-19.
That plan does not include a statewide mask mandate. 9 News reporter Angeline McCall joining us now to break down what the state is preparing to do if the numbers stay the same or even worsen. Angeline.
Yeah, Tom and Kim, that first step is moving monoclonal antibody treatments from hospitals to mobile buses and urgent care centers in hopes that it helps hospital staff as they deal with capacity issues. Now, in the upcoming days or weeks, if those don't get better, we could also see a request to FEMA for medical surge teams. We could also expect a stop to cosmetic and elective surgeries, along with reactivating crisis standards of care, as well as a new executive order on patient transfers. The big push, however, today is getting children ages 5 to 11 vaccinated per day. Roughly 15 to 20 children are in Colorado hospitals getting treated for COVID-19. And doctors say they have seen a 4% increase in pediatric COVID cases compared to the summer months. Governor Polis is asking parents to make sure that they get their kids vaccinated.
And this is an important step forward. We've never shied away from bold goals in our state, and we are continuing to focus on vaccinating people of all ages and boosters, right? Walking and chewing gum at the same time. But we are setting the goal of vaccinating half of our 5 to 11-year-olds by the end of January of 2022.
In order to reach that goal, there is a plan in place to set up vaccination events at areas where families would go anyways, like museums and libraries. The governor also said that parents would have an opportunity to get a booster at those events as well. Kim, Tom?
That's the idea, is these newer vaccinations, whether they be boosters or just for young ones, can really hopefully have a big impact on the arc that we're seeing right now.
Yeah, they're certainly hoping that, because right now we do know that children are responsible for at least some, if not more than most, of the infection rate that we see here in the state.
Yeah.
All right.
It's interesting. We've had these numbers rise, and we've been doing so well, so it's concerning. All right. Thank you, Angeline.